Hello and a very good afternoon to all our viewers on Facebook and YouTube. And today we will be talking about one particular problem that all the recovered COVID-19 patients are suffering even after recovering from the deadly pandemic. Well, now if we have to talk about the recovery rate in India and across the world, the rate has been on the upward with each passing day, but there is another threat that is looming large with recovered patients. And recently, one of the COVID-19 recovered patients thought of returning to work after recovering from the viral infection, but he later realized that he could not walk even small distances without his heart rate increasing. So he was readmitted for an echocardiogram to check his heart health, and although the patient's family has a history of heart disease, he did not have a pre-existing condition. So he only had a borderline diabetes and also hypertension. And he got an MRI scan done, and the scan revealed that he had developed myocarditis, which is the inflammation of the heart muscles. In fact, according to details revealed by one of the doctors currently on COVID-19 duty, some of the patients are returning back to the hospital with reduced heart function and heart attack or even a stroke. And this could be due to the damage to the small vessels caused by COVID-19 that leads to clotting during the course of the disease. Well, COVID-19 is known to attack the endothelial cells that line the blood vessels that lead to clotting across the body. And in another report, a team of doctors in China have claimed that lungs of 90% of COVID-19 patients who recovered in Wuhan are still damaged. So the team led by Peng Xiong, the director of Zhongnan Hospital of Wuhan University, has been conducting follow-up visits with close to 100 recovered patients, and the team found that the recovered patients could only walk for 400 meters in 6 minutes, unlike the healthy peers who could cover a distance of 500 meters in the same time. So the team also noted that some of the patients have to rely on oxygen machines even 3 months after being discharged from the hospital. Well, according to their study, it was found that antibodies against COVID-19 in 10% of the 100 patients had disappeared. And the doctors have also claimed that those coming back to the hospitals after their recovery alleged low oxygen saturation and also secondary infections. So now, in order to decode these problems, we have with us Dr. Huliraj, who is a very prominent pulmonologist from Bangalore. So welcome to this live interaction, Dr. Huliraj. And my first question is, does COVID-19 leave a permanent dent on a human body even after the patient recovers?
As you know, everybody knows COVID is a still a young disease to India and foreign country or world. So still we are studying as a specialist, as a pulmonologist or various care providers. We are still studying, assessing what is the end stage problems. As of now, past 6 months, say 6 to 7 months, whatever what we are seeing, I think it is causing a significant destruction to multi-organ. Multi-organ, not just one organ, can be heart, can be lungs, can be brain, can be muscles, can be intestine. So majority of the body can get affected. So one of the prominent being cardiac and lungs are the major end stage damage organs. So now we are finding a lot of significant in as I am pulmonologist, my area of more interest was the lungs. We have significant amount of person having a lung damage. So one of the commonest things what we see is acute interstitial pneumonia. Some sort of a lung damage occurs where oxygen gets blocked at the lung parenchymal level. Oxygen cannot cross the lungs and enter the system. That is one of the major issue, and along with that there is always nodules are there, granular appearance are there. And as you rightly told, secondary infection is known, especially now monsoon setting across India. Possibility of secondary infections are more as people are exposed to cold and rain, causing the widespread problems. And as far as the heart is concerned, I think it has been extensively studied in various countries, including China and Germany. The MRI being done for a lot of patients and post-COVID recovery, and they found there is inflammation and also almost 70 to 80% inflammation and another 10 to 15% fibrosis. So that is the same fibrosis can affect various parts of the body, whether it could be kidney or lungs or intestine or heart. It is known to cause a problem. So as we are seeing, studying the cases, different conditions, different personals, various studies coming across the globe, all pointing out that it is causing end organ damage, what is called fibrosis, maybe failure, especially as far the lung is concerned. Respiratory failure is known that lead to people going on the oxygen concentrator. Only time will answer how the recovery, whether it is going to be a permanent or it is going to be a transient, time only will answer. But as of now, quite a bit of patients on oxygen and needing continuous treatment, various type of medication for them to counteract the damage going on inside the body, especially in the lung.
Okay, also doctor, now one of the patient who recovered, he wanted to go back to duty, but then he couldn't walk for more than 400 meters in less than 6 minutes. So the doctors claim that he suffered from myocarditis. So what is this myocarditis all about, doctor?
The myocardium is the heart muscle,
Okay.
which is being affected by the viral COVID-19 infection.
Okay.
So which cause the inflammation and damaging the lungs, heart, and causing the fibrosis, inflammation, maybe small clots in the arteries, small arteries, and causing the heart attack, and other stroke, other organ damage, all can cause. Definitely it is possible.
Also, doctor, now many even complained of respiratory problems even after recovering. So what kind of damage is inflicted by COVID-19 on the lungs?
Lung fibrosis, what we say, lung fibrosis.
Okay.
So initially maybe acute it is pneumonia type features, acute interstitial pneumonia, followed by long-term maybe lung fibrosis it is expected to cause. Even in China, they found some of the institutes, more than 90% of the people who recovered patients of COVID having left with the lung damage, what is called lung fibrosis, where they'll end up in long-term, if the severity is there, they may land up in as a respiratory cripple and maybe oxygen for lifetime.
Also, doctor,
but it is too early to comment that way.
Okay.
Because still we are studying, because we don't know. Still every day new things are coming up, new symptoms, signs are cropping in, and we have to plan, strategize. What are the drugs? Because we don't know drug of choice also. Whatever the things, it is some extent 10%, 20%, 30%, 50%, and the asymptomatic they heal by itself. We really do not know, so time only answers. But definitely, whatever we have seen the patients, COVID patients recovered 1 month, 2 months, 3 months, what they have a significant history, especially cough and breathlessness is an issue, chest pain, and they are unable to do routine what they used to work, regular exercise, regular walking, regular job. So now, it is a time only we should answer.
Also, doctor, now post-recovery rehabilitation is becoming very important. So, what do you have to say about this?
I think so. See, the most important thing is anybody who has suffered from COVID, they should get evaluated properly.
Okay.
They should, because if you continue to be in the loop of treatment, if the specialist with them, I think something can be achieved, including pulmonary rehab and other rehabilitation therapies and all. And even treatment, see what happens is, once you see everybody look at the conversion of positive to negative, that is not. See, end stage is, you have a situation where it has left you with a lot of damage to various vital organs. That has to be assessed and analyzed. And what is the end stage? See, initially they might have done CT scan, follow-up CT scan, say after 30 days or 6 weeks or 8 weeks or 12 weeks, something like that. Some test has to be done and see, follow up the patients with that, whether whatever the damage which has caused is cleared, healed, or it is having a residual issues which are still lurking. That has to be done for every organ, that has to be analyzed, whether it is ultrasound abdomen or ultrasound CT scan of the lungs or 2D or the cardiac or the brain, whatever it is. So intensively patient has to go through. They should have a strict follow-up with their personal physician or a pulmonologist or a specialist who is interested in COVID. They should have a regular follow-up, and see to it has been declared cured by going through all the tests, runs of tests, and say that you approved that lungs are not damaged or recovered or recovering. If it is recovering, what is the plan of action for treatment? What is the protocol? What is the medication? That has to be strictly. See what happens in Indian scenario. People try to modify the management medication themselves. I am all right. Why I should take unnecessary medication? That attitude. should not be there. They have to strictly follow up with the professionals who are involved with that and get the evaluated. If the doctor is not, you can always ask for the test and get the things done, and you can get it, see to it is proved that it is cured. Otherwise, you're going to have an issue. So long-term follow-up is the need of the hour.
Right, doctor. Thank you for joining us. Yeah.
Major issue they have to follow, including chest physiotherapy, incentive parameter, and lung exercise, other things. In all is needed, and along with the treatment.
Okay. Thank you, doctor, for joining us with all those insights and all those details as well. So, well, as Dr. Huliraj said, it's not just about recovering from COVID-19, but also following up after recovery and getting yourself evaluated, because COVID-19 inflicts damage to multiple organs in your body. And even though you have recovered, there might be some underlying problems which you would not notice in the short term, but once you recover, 1 month or probably even 2 months down the line, you will start noticing the changes in your routine work, because you wouldn't be able to complete your routine work like you used to do before being infected by COVID-19. And that is because COVID-19 inflicts damage to multiple organs, that is your lungs, even your heart, and also the blood vessels, which is very important. So get yourself checked, but instead of going to that point, it is better for us to, stay safe and also follow all the safety protocols, because we wouldn't want to be infected by COVID-19, and then also even after recovering, we wouldn't want to suffer in the aftermath. So instead of going to all of that and reaching such a phase, it is better that we take precautions in our current situations. And also not to forget, we should always maintain a good hand hygiene and also a personal hygiene, because COVID-19 can only be defeated by following safety protocols. With that, it's a wrap on this live interaction today, and until next time, take care, guys.